Chapter 7, that we're in the fifth week, or this will be the fifth week. Anyway, there's a reason why I'm not showing you myself. It's that heat dome that they were talking about, that they've been talking about for a couple of weeks. It's hit here, and it's hot, and our air conditioner's not working. So I'm sitting here without a shirt on. I don't look as good as this guy right here, but hey, whatever. You don't need to see that, that's for sure. So let's go ahead and get started. We're going to talk about somatic symptoms and dissociative disorders. Kind of a fun chapter. Probably, potentially, you've never seen anybody like this. Well, there's hypochondriacs. Hypochondriasis, which we don't call hypochondriasis anymore, that's part of the somatic symptoms. So we'll go through this and you can see if you've ever seen anything like this. I think the best way to understand all of these mental illnesses is to equate it with something that you've seen or something that you've been around, potentially, that maybe you overlooked. I think that's probably the best way to learn about mental illness. Uh, Personally, I've seen most of this stuff. If not in the emergency room, then while I was in training. So let's go ahead and get started. Maybe. There we go. There we go. Somatic symptom disorders concern bodily symptoms which are thought to have psychological causes. Dissociative disorders concern certain disruptions of consciousness, memory, and identity. These two categories of disorders were important to the founding and development of psychoanalytic thinking. These disorders are unusual and sometimes controversial conditions, and this is part of the problem with mental illness, is the fact that we have all of these problems that we see. We know that they're not normal, but we haven't put a name to them yet. And because of that, and because some cultures accept these somatic ideas or these dissociative ideas, religion, for example, accepts a lot of concepts of dissociation. Because of that, it is difficult to identify when it is abnormal, when it's not socially acceptable. So that's what makes these such interesting mental illnesses. Somatic symptoms and dissociative disorders in which unusual symptoms cannot be confirmed, apart from self-report, may be difficult to distinguish from circumstances in which individuals intentionally fake their symptoms to receive some gain. And this is known as malingering. When I was in the military, malingering is one of the rules, one of the laws is against malingering. Malingering means that you have made up your symptoms and you're doing that to stay out of combat or to get out of work, and it's known as malingering. So I'm very much aware of malingering because it's a military concept. The idea that you are just faking your illness to get out of work. Malingering is not a mental disorder. It is included in the DSM-5 under other conditions that may be a focus of clinical attention under the subset non-adherence to medical treatment. According to the DSM-5, malingering involves the intentional production of false or grossly exaggerated physical or psychological symptoms motivated by external incentives such as avoiding military duty, avoiding work, obtaining financial compensation, evading criminal prosecution, or obtaining drugs. Why would anyone report false symptoms or pretend to have a mental disorder? Imaginary and exaggerated symptoms may bring social attention that might not otherwise be available, allow one to avoid an unpleasant obligation, or create a situation that frightens other unwanted people away. And if you've ever pretended that you had the flu in order to miss a spelling test when you were in the third grade, you were malingering. People facing legal charges may attempt to portray themselves in a way that minimizes their personal legal responsibility. And this is what Harvey Weinstein did. I don't know if you remember the Harvey Weinstein case, but he molested a number of actresses. Uh, at some points, he would not give them acting jobs unless they had sex with him. And if you remember his first trial, he came in a wheelchair, acting like he was so feeble he could barely function. Another individual that did that was the guy from Australia that owns that owns Fox News. What is that guy's name? What is that guy's name? The guy that owns Fox News. Rupert Murdoch. Rupert Murdoch did exactly the same thing. All of a sudden, he was being sued by England, by the UK. They were suing him because he one of his reporters had made up a text that a girl that had been killed. She made up a text that was sent out so that they would not stop looking for her. She was already dead. She'd been dead for a week, and here this lady created this text that that indicated that she was still alive, and because of that, they not only kept looking for her as if she were alive, but they also started communicating with this fake individual because it was one of the reporters, and so he got sued, and he came into court, acted like he was demented, that he was suffering from dementia. Of course, today, if you see him, he's walking around and talk. He's in his 90s, and at that point, of course, he acted like he was one step out of the grave, one leg out of the grave. It was really kind of interesting. So people can do this, and people will do this in order to get out of legal responsibilities. Financial benefits from federal agencies or insurance companies may be contingent on diagnosis of a mental disorder, and for that reason, people will create false ideas or false symptoms. A person is undergoing an evaluation or legal purposes. One study found 8% malingering incidence rate in criminal defendants undergoing psychiatric evaluation. A person's report of disability or distress is inconsistent with objective findings. A person is uncooperative in the diagnostic evaluation. If antisocial personality disorder is present, often involving lying or conning for personal gain. These are all reasons for malingering. Malingering may be overrepresented among certain conditions such as PTSD and mild head injuries, and that's a problem. My grandson used to play soccer with an individual, and in every game, this kid would either land on his head or head the ball, and all of a sudden he would go down with a head injury. It was weird. Um, as he got older, this is when he was much younger, 8, 9, 10 years old. Now that he's almost 13 years old and has gone through puberty, by golly, his head injuries have gone away. It's really one of those Christmas miracles that we so often are looking for. Uh, the somatic symptom and related disorders involve bodily symptoms that produce abnormal thoughts, feelings, or behaviors. The symptoms may or may not be medically explained. In the DSM-5, there is no longer a requirement, as there was in the DSM-4, that supporting physical evidence is absent. The symptoms for most somatic symptom disorders are not intentionally produced or faked. Factitious disorder is the exception to this. Factitious means fanciful, untrue. The DSM-5 extensively modified DSM-4's somatoform categories. Body dysmorphic disorder was moved to the obsessive compulsive and related disorders. We talked about that last week. Several conditions, hypochondriasis, somatization disorder, pain disorder, an undifferentiated somatoform disorder were removed, and the symptoms they classified were redistributed to new syndromes that are less concerned with the unexplained medical symptoms and more concerned with the thoughts, feelings, and behaviors the sufferers experience. These changes may lead to improved reliability of diagnoses. In the DSM 5 field trials, complex somatic symptom disorder scored a kappa of 0.61, earning it a very good reliability classification. So there you go. It's got a kappa of 0.61. Unlike malingerers, people with factitious disorder invent or exaggerate their symptoms for no obvious reason apart from plain sick. This is a DSM 5 disorder. Prior to the advent of the DSM 3, this condition was called Munchausen syndrome. The fabrication is not the result of another condition such as psychotic or delusional disorder. DSM-5 specifiers for factitious disorder include single episode and recurrent episode. Usually the episodes are intermittent. Yeah, I can remember the Munchausen syndrome. Munchausen was a royal from Eastern Europe, and he came into the Western courts and he made up all these amazing stories about what he did. And some of them were really, really fanciful. And for that reason, they started referring to, these made up stories that are really amazing as Munchausen syndrome. Really kind of fascinating. They actually made a movie about Munchausen. I don't know, about 20 years ago or so. Like malingering, the degree of accuracy in the feigned presentation is likely a function of the level of sophistication of the person's understanding of the disorder. Typically, the symptoms worsen when an individual is aware of being observed. The prevalence estimate of 1% among hospitalized patients is not very useful because feigning is probably not detected with great accuracy, and a person's ability to make the symptoms appear authentic may improve as interactions with medical professionals increase. Factitious disorder imposed on another involves falsely presenting symptoms in another person. In the DSM-4, this condition is called factitious disorder by proxy. In this condition, the false symptoms are produced on behalf of someone else who is typically under the individual's care. Most often, the victim of factitious disorder imposed on another is a preschool child, and the perpetrator is the mother. Like factitious disorder, external incentives for the deception are absent. And this is a case of Munchausen syndrome by proxy. We don't call it that anymore. We call it factitious disorder by proxy. This mother was poisoning her own daughter so that people would pay attention to her. This is her. Oops, I'm sorry. This is her when she was sick, and this is her now. They took her. They took the child away from her, and eventually she didn't. She was looking for attention, is what she was looking for, and she was using her daughter's illness to gain attention. It wasn't like she wanted to kill her daughter. This has happened in the past. Actually, that is part of the what was the movie? The Sixth Sense, the one about I can see dead people. That one had a Munchausen syndrome by proxy. The mother was poisoning the little girl, and they discovered it. The boy discovered it, and I think they saved her life. I'm pretty sure they saved her life. Anyway, Munchausen syndrome by proxy, it is very real. I've seen it myself when I was working in Omaha, not at the Children's Hospital, but at one of the other hospitals where I worked, Bergen Mercy. We had a case of Munchausen syndrome by proxy. It's really kind of a curious case because Bergen Mercy Hospital is a Catholic hospital, and the mother that was killing her daughter, not on purpose. She didn't really want to kill her. She just wanted her to be sick. And it was a very similar case to this one. The lady was overweight. Her husband was a very handsome man, and he didn't pay a whole lot of attention to her, but he paid more attention to her when her daughter was sick, and for that reason, she made her daughter sick a lot. It was really kind of an ugly situation. They didn't want to admit it. It was really kind of curious how they discovered it. Um, it was another lab tech. I was working as a phlebotomist, and it was one of the lab techs that discovered it. I didn't have much to do with it. I just observed it and, and kind of testified. They decided not to prosecute or do anything to her, uh, but they put the child in under Child Protective Services observation, and after that, the mother didn't do anything, and the mother and the father actually got divorced, and after that, everything was fine. Anyway, it's a really interesting case. Somatic symptom disorder involves multiple physical complaints that disrupt daily life. It can be specified as mild, moderate, or severe, depending on the number of symptoms expressed. There may or may not be an underlying medical condition. Those with the disorder tend to worry about illness a great deal and interpret their symptoms as overly serious or threatening in spite of evidence to the contrary. The disease concerns, which cause distress but do not reach delusional intensity, typically have lasted at least 6 months, and I've seen this a lot. There was an assumption that psychosomatic disorders um, were about 60% of all the cases the GPs were seeing. And of course, we saw this in Oklahoma when I was working in a rural healthcare clinic. Uh, we had lots of individuals coming in with really strange problems. We had one lady that would come in every time she had migraine headaches, and all of a sudden she'd come running into the place, and she'd need a shot of Demerol to waylay her her headaches, and we couldn't figure out what was going on. This had been going on forever. Um, and you had to Z-track her, which means that you'd have to take an inch and a half needle, and you'd have to stick it in a half an inch. Then you'd have to turn it 90 degrees and stick it in another half an inch, and then turn it another 90 degrees and stick it in, because we were shooting her in the gluteus maximus, her butt, and it was so porous that it would, if you just stuck it straight in, no matter how deep you stuck it, if it was a straight line, it would just come shooting back out. So we had to Z-track her. That was not fun for her. Well, I don't know, but she didn't seem to mind. It was Demerol after all. Anyway, it turned out that every time her husband was a long haul trucker, and he would call and say, "I'll be home. I'll be home at 6. I'm in Tulsa, and I'll be home in an hour." That kind of thing. And anytime she heard her husband was on his way, she would develop a migraine headache, and nobody figured it out. I mean, you know, everybody's just assuming that she's got migraine headaches. Eventually, we cured her migraine headaches. She cured her own migraine headaches by divorcing her husband. He was a really nice guy. Not exactly, well, anyway, not important. I don't have any idea why that picture is there. The disorder appears to be common in females, more common in females than males. It is difficult to get an accurate estimate of incidence of the disorder, but the DSM-5 suggests it may be between 5 to 7% of the population. Psychogenic, psychologically caused non-epileptic seizures were reported in between 10% and 20% of patients who were referred to an epilepsy center in Britain. The incidence of people who experience 6 or more symptoms from two or more bodily sites is about 1.8% of the population. So the somatic symptom disorder. Ooh, as I suspected, acute pretendicitis. Yeah, I used to do this. I used to get pains. It was probably constipation, but I was afraid it was an appendicitis. It worked. I didn't have to go to the spelling test. Somatic symptom disorder is more frequent in those who have experienced recent stressful life events, have low socioeconomic status, and have fewer years of education. Sexual abuse has been found to be 9 times more likely in the background of somatic symptom disorder patients than in matched patients with major depressive disorder. Behavioral perspectives generally focus on the consequences that somatic symptoms might present to the sufferer. Cognitive viewpoints typically involve the unduly harsh and catastrophic appraisals that sufferers make of their symptoms. Psychoanalytic perspectives tend to view medical symptoms as evidence of anxiety produced by unconscious conflicts, often involving sexual themes. And this is one of the realities of the somatic symptom disorder is the fact that there tends to be a sexual component to it, unfortunately. And what does this say? What you don't know can hurt me. More than 70% of child sex abuse cases involve a relative friend. Oh, no, it's not exactly what I was thinking it was. Before you turned 18, 1 in 6 boys experience some form of sexual abuse. 1 in 4 girls experience some form of sexual abuse. So there you go. By its multi-symptom nature, somatic symptom disorder is difficult to treat and rarely remits completely. Those who seek treatment are often shocked at the suggestion of mental health intervention. Because of the significant overlap with anxiety and depression, therapies for these disorders have provided relief and some symptom reduction. Cognitive behavioral therapy is the favored treatment with the stronger evidence of its effectiveness than is found for other approaches. And of course, CBT has to do with telling people that they have a mistaken way of thinking. They need to think in a different direction. They need to think in a different way. That's what cognitive behavioral therapy is all about. Why do you keep thinking about this? Why do you keep ruminating about this problem? The more you think about it, the sicker you tend to get. For those diagnosed with the specifier, some antidepressant medications have produced pain relief, especially the selective serotonin reuptake inhibitors. Cognitive behavior therapy has been widely employed for pain management, stress reduction, and activity enhancement. Randomized trial studies support its effectiveness. Acceptance and commitment therapy changes one's perspective on the chronic pain by focusing not on pain control, but on accepting its presence and valuing pain tolerance. A lot of people, when they first have pain, they want to hit it with something really hard. Here, give me Demerol, give me morphine. I need OxyContin. I need fentanyl. Hit me hard, so the pain goes away. And what ACT does is it trains the individual to accept their pain and to try to develop pain tolerance. And there you go. Ouch. Conversion disorder refers to symptoms or deficits in voluntary motor or sensory function. Diagnosis requires the presence of one or more of these sorts of symptoms to the extent that it causes clinically significant distress or impairment or warrants medical evaluation and is not accounted for by another condition. There must be evidence that the symptoms are not explained by neurological disease. Conversion disorder is specified as following by type, for example, with weakness or paralysis, with anesthesia or sensory loss, with abnormal movement. And by duration, is it acute or is it persistent? whether it is social stressors that have been involved in causing the problem. Conversion disorder was very common during World War One. Individuals in the trenches wanted to come out, of course, because of the probability of being blown up by explosives, or being machine gunned down while you're running across no man's land. These are all problems, and people would have these conversion problems where they would get wounded in the shoulder, and all of a sudden they couldn't walk, or they would have a blow to the head and they become paralyzed. These kinds of things, and these are known as conversion disorders. Conversion disorder appears to be rare in the general population, less than 0.01%, but may be involved in 5% of referrals to neurological clinics. It occurs 2 times more often in women than with men. Clues that suggest a diagnosis of conversion disorder include symptoms that do not correspond to known anatomical pathways, labile indifference, an obvious lack of concern about the symptoms, inconsistency of symptoms. You're limping on one leg, then you're limping on the other leg. You cannot speak in a normal tone but can cough. You can move paralyzed body parts while asleep, but not while you're awake. And these are all problems with conversion disorder. Remember, you can't speak, but you can cough. Conversion disorder can cause partial or complete paralysis of the arms, legs, or other body parts. This is really kind of interesting because if you read Freud, he called conversion disorder hysteria. And he saw a lot of hysteria. This was during the late 19th century, is when he was working with this. And what he saw was this was a time of sexual repression. The sexual repression in Vienna, where he was extreme. So women would come down. Women would go blind if they saw their husband's penises. If they saw their penis, if while they were having sex, she moved her hips, all of a sudden she'd become paralyzed. She couldn't move her legs because she had moved during sex. It was a really strange time, and this was all attached to religion. The religion was trying to tell people that they needed to control their urges and whatnot. And because of that, hysteria was very common. So when you read Freud, you need to understand the historical context of the time that he was talking about. With all the strange pornography on the internet now, sexual repression seems like it was unreal, like it couldn't possibly happen. But the reality is, of course, that was a different place and time. It was Austria, for one thing, and it was also a time when women weren't allowed to show any skin at all. It was a time where dresses had to cover all the way down to the floor. Um, if a man saw your ankle, it was sexual. You had to wear gloves going outside. You couldn't show anything like your wrists. Oh my goodness. Women wore veils over on their hats so that men wouldn't really, see them. It was just a really different time, and we need to understand the historical context of all these things. Okay, so we're talking about paralysis. Convergent disorder can cause selective loss of function, such as writer's cramp, in which the person cannot write but can use the same muscles for other purposes. Conversion disorder can cause contractions involving rigid flexion of fingers, toes, knees, elbows, or other parts. Conversion disorder can cause astasia, abasia, the ability to move legs when lying or sitting, but not to stand or walk. Conversion disorder can cause speech disturbances, mutism, total inability to speak, Orophonia, ability to speak only in a whisper. A conversion disorder can cause convulsions similar to epileptic seizures. Conversion disorder can cause tics, muscular twitching, usually around the eyes or the mouth. And if you've ever seen, oops, there you go. This is from the Pink Panther. He developed a tic. They kept trying to kill Peter Sellers' character. And there's another tic. He can't put his foot down flat. He has to walk on his toes. Disturbances in vision, total or partial blindness, tunnel vision, blurred vision, double vision, or night blindness. Disturbances in hearing involving total or partial deafness. Anesthesia, general loss of sensitivity to stimulation of the skin. Glove anesthesia, lack of feeling or numbness in the area of the hand and wrist. Analgesia, insensitivity to superficial pain, stimuli applied to the skin. Paresthesia, false sensations such as tingling feelings in the skin. And that's what glove anesthesia looks like. You can't feel your hand. As weird as that is. Your whole hand. Now the reality is that if you've ever had part of your hand has gone numb because you put your arm someplace for too long a period of time, the underside of your arm controls your two outside fingers, your ring finger and your little finger. Your middle finger is right in the middle of your arm, so your middle finger rarely gets numb, but your thumb and your forefinger, they can get numb if you put pressure on the top of your arm, and that's reality. Okay, so in order for the whole hand to go numb, it's almost impossible. You have to just about cut off circulation to the entire arm. Conversion disorder, other somatic symptoms: lump in the throat, coughing spells, persistent belching or sneezing. When you burp and sneeze at the same time. I don't think that's one of them. I don't think the skeleton is one of them either. Psychoanalytic perspectives view the particular conversion symptom as the product of unconscious psychosexual conflict. Conversion disorder is essentially considered a form of autosuggestion or self-hypnosis to express and relieve conflict. Behavioral perspectives generally presume the secondary gain maintains conversion disorder. In many cases, the immediate motive for developing a bodily symptom may be to escape from some emotionally unbearable situation. You've got a horrible thought in your mind and you need to get away from it, so all of a sudden you develop one of these conversion disorder problems. Selective mutism, and of course we saw that in the Big Bang Theory when it first started. The Raj, the Indian scientist, couldn't speak to beautiful women because he was scared of them. And so he had selective mutism, and that was a conversion disorder. As curious as that is, a lot of these have to do with sex, because in a lot of cultures, sex is there are aspects of sex that are taboo. Seeing someone naked, certain types of interaction between men and women. Maybe having sexual desires for the same sex. All of these things can cause a conversion disorder. We live in a less repressive time when it was a more repressive society. We saw a lot more of these. An interesting recent speculation appeals to mirror neurons to account for the social contagion of hysterical symptoms that may occur within families. The inhibitory component of the mirror neuron system, which normally prevents us from imitating everything that we observe, may be faulty in certain subjects, leading them to copy the hysterical actions of others. Mirror neurons are more active in women than in men, which possibly explains the higher female incidence of conversion disorders. And this is how we discovered mirror neurons. This is a relatively newborn baby, and the baby will mimic what he sees or she sees. He opens his mouth, she opens her mouth. If he makes a face, the baby will make a similar face. And these are known as mirror neurons. And we discovered this not only by having newborn babies mimic facial expressions, but also looking at chimpanzees. I did this with my own, with my nieces. This is before I had children of my own. And oh, I'm so bad. My sister had a daughter, two daughters before I had any kids of my own, and so I would help her with the babies, and one of the things I would do, I would stick out my tongue. Um, I didn't think anything about it. I'd been studying psychology, and so I would stick out my tongue, and then they would stick out their tongue. Well, my sister was married to a Polish gentleman, Polish extraction, but the mother-in-law had actually come from Poland, and evidently sticking out your tongue in Poland was taboo. And I didn't really realize what I was doing. So I got, that's how I would play with the kids. I would make faces at them, and they would make faces back at me. And so, busha, that's what they called it. So when the mother-in-law would come over, here the babies would be making all these strange faces, and she was appalled. She was sure that their faces were going to freeze that way. And it was mirror neurons that did it, and I was the culprit. Psychoanalytic approaches involve therapy aimed at providing recognition of and insight into the underlying conflicts presumed to be causing conversion process. The conversion process. Demonstrations of the effectiveness of these approaches are limited to case studies, sometimes simply telling the patient that the symptoms will disappear or showing the patient that the test results from the examination are normal will show improvement. Contemporary cognitive behavioral approaches remove the reinforcing consequences of the conversion symptom while they weaken the traumatic reaction to the initiating event. Illness anxiety disorder was categorized as hypochondriasis in the DSM-4, but was redefined by the DSM-5. Illness anxiety disorder involves a preoccupation with the fear that one has or will acquire a serious disease, although somatic symptoms, if present, are mild and frequently transient or normal physiological functions. Reaction to these mild symptoms or existing medical conditions is clearly excessive and disproportionate to their actual severity, and it is not alleviated by a medical evaluation that finds no presence of disease. The presence of the feared disease becomes central to self-image and can disrupt family, social, and occupational relationships. And I have one of these illness anxiety disorders right now. Every time I lose a job, and I've just lost my job at Dene College, I won't be coming back in the fall, I react negatively. And what's happening at this point is that I'm having kidney problems and heart problems. Now, the amazing thing is, and I'm going to admit it to you guys because you're my buddies and you won't tell anybody, but the amazing thing is I applied for another job. I don't know why. They're not going to give me a job. I'm 75 years old. Nobody's going to hire a 75-year-old psychology instructor. Anyway, I applied for a job today, and all my symptoms that I've been suffering from over the last week, they all went away. Everything went away. I was uh, I was starting to get winded when I walked. Well, I had my kidney, my left kidney hurt. I was My legs were becoming edematous, which means their fluid was pooling in my legs. But then I applied for this job, which is a couple hours down the road, and all of a sudden my symptoms went away. My back pain went away. I feel great. All I had to do was apply for another job. Wow, I'm a psycho. With the number of symptoms you describe, our only hope is to remove your home health encyclopedia. I don't care what it said when you looked up your symptoms on the internet, you are not anorexic. Another joke. Anybody can be as crazy as, as this, and I know all this stuff. I've been teaching this stuff for years, for decades, and here, I got the same problem. I did have a heart attack after I lost my job at Fort Belknap College. I did have a heart attack after that, and I've had um, several stints put in since I've been here in Iowa, and that's one of the reasons I can't come back. I can't live at 7,000 feet. I'm at 700 feet right now, and I'm doing fine except for this heat dome that's cooking everybody in Iowa. I hope it doesn't. I hope we get rain, because if we don't get rain, the corn crop's gonna wither and die. And everybody's got corn. Everybody planted corn this year because of the tariffs and all the problems with China. China buys most of our soybeans, so hardly anybody planted soybeans this year. No clear differences in incidence of illness anxiety disorder have emerged based on the prevalence estimates for hypochondriasis from the DSM-4. It appears to affect about 1.3% to 10% of the population. Up to one half of cases are of transient type, while for others the course is usually chronic. Uh, and it can be women, it can be men. There is no difference, I think. I know I'm a hypochondriac, but I'm certain it's caused by a brain tumor. Well, at least I don't have a brain tumor. Based on studies of hypochondriasis, no genetic influence is evident. Illness anxiety disorder can occur with several conditions, including anxiety, depressive disorder, and other somatic symptom disorders. Psychodynamic clinicians have assumed that patients defend against poor self opinion by displacing attention onto physical sensations and symptoms. And I guess that would make sense. Here I am, I'm a college professor. I'm a college professor. I've got 5 degrees, 3 of them are advanced degrees. And when I'm not working, when I'm not teaching, my self worth seems to decline. Therefore, I develop these symptoms. And part of it could be depression. I'm losing a job, and I really enjoy teaching the students at Dene College. I feel, and part of my problem may be the fact that I feel like my students are my kids. I I feel a responsibility for you, for your success in the future. Um, I can really mess people up, and I don't want to do that. I certainly don't want to do that. Uh, some people don't care, but I do. I want to help everybody. I don't want to not pass anybody. It bothers me when I have to not pass somebody. So, but I'm not going to pass somebody if they don't do any work. That doesn't make any sense. That doesn't help you, doesn't help anybody. Cognitive and learning influences are presumed to be important in the development of the disorder, since a misinterpretation of bodily symptoms is central to the diagnosis. DSM-5 provides a category for cases in which the evidence is clear that a psychological factor is interfering with treatment or having significant influences of medical outcome. Now, this is really kind of interesting because this morning I found that job that I was talking about. I just applied for it. It's not that big a deal. I know I'm not going to get it. I'm sure there's like 100 people that are trying to get the same job. But just applying for it made me feel better. And if I hadn't found that job, then potentially I wouldn't be sounding as positive as I am right now. I would still be worried about my back. I'd still be worried about my kidneys. I'd still be worried about my heart. Um, and right now, I'm not worried about anything. I feel pretty damn good. So there you go. Behavioral or psychological factors can negatively impact an existing medical condition, increasing the risk of death or disability. And of course, you can you can will yourself to death. Most people do accept death, and that's why they do die. Um, or you can will yourself to be disabled. Um, I had a colleague. Well, he was. I went to college with this guy, and brilliant guy. Um, and in order for him to look more professorial, he grew a beard. He started wearing glasses, and he never wore glasses before, but he started wearing glasses, and he became crippled. As interesting as that, I never quite understood that. I didn't want to argue with him about it, how why his legs are suddenly barely functional. But yeah, he grew a beard, started wearing glasses, and has trouble walking. Brilliant guy. I mean, just funny as all get out because he's so smart. Well, anyway, the interfering psychological or behavioral factors are not better explained by another disorder and should occur in close temporal relationship with the worsening of the existing medical condition. It can be specified as mild, increases medical risk, moderate, or aggravates underlying condition, severe, necessitates hospitalization or emergency room care, or extreme, results in threat to life. Other somatic symptom disorders, this category allows coding or conditions that involve somatic symptoms but do not meet the criteria for particular disorders. The symptoms might not meet the required 6 months of duration, or the specific symptom may not be included among the disorders. Pseudocyesis, false symptoms of pregnancy, would belong in this category. I have big news. I'm pregnant. Men can't get pregnant. Don't be a sexist. Pseudosciences. Okay. Localized amnesia is failure to recall events that happened during a circumscribed period of time. Selective amnesia, a person can recall some but not all events during a particular period of time. Generalized amnesia, complete loss of memory for one's life history and perhaps one's identity. Much rarer than localized or selective amnesia, generalized amnesia tends to occur with those who have experienced combat, sexual assault, or extreme stress, more likely to involve dissociative fugue. Now, this is really kind of interesting. And I'm checking to see if my wife's around. Before I married my wife, and we've been married for 46 years. Before I married my wife, I had a girlfriend, and that girlfriend married somebody else. Okay. But she kept in contact, strangely enough, and I really liked her a lot. And sometimes I think, well, maybe I should have married her. But then again, she married somebody else. Okay. Now, here's the weird part. So we kind of kept in contact, and she kept getting married and divorced, married and divorced. And I really had a hard time figuring out what her name was this week. It was one of those kind of deals. She'd call me maybe every 6 or 7 months. She would make contact and ask me this and ask me that. And it was really kind of I thought she was trying to maintain contact for a reason. Couldn't figure it out. Every time she got a divorce, she'd call. Every time she got married, she'd call. So the last time she got married, she called and she said, I'm marrying Orrin Bond. I'm marrying Orrin Bond. That's the way I remembered it. Now, here's the bizarre part. She didn't marry Orrin Bond, and she probably didn't tell me she married Orrin Bond. She married Olin Blair. So here I am, I stuck it in my brain that she married Orrin Bond. And so for years, whenever I thought about making contact with her, I'm looking for Orrin Bond. I'm looking for Brenda Bond. As it turned out, of course, that's not her name. I had to hire a private investigator to find out who she was because that's selective amnesia is what it is. In order for me to not ruminate on that situation, I changed the lady's name, and I changed her husband's name. I could have looked for Olin Bond, and maybe I would have found Olin Blair, but that's kind of a strange Southern name. Anyway, that's selective amnesia that I had. Okay. Wow, I'm sounding real crazy, huh? Okay. Dissociative disorders involve certain altered states of consciousness and disruptions of the memory and identity. The psychologist should always consider cross-cultural factors. When such disorders are diagnosed, such altered states may be cultural. Now, you may ask yourself, why in the world would I have selective amnesia in this case? And the answer is in order to protect myself. Because if I knew her actual name, I might try to contact her whenever my wife and I were not getting along very well or whatever, and who knows what would have happened from there. So I had selective amnesia in order to protect myself. Isn't that weird? Okay. Dissociative disorders are generally rare conditions and typically associated with stressful or traumatic experiences. Dissociative amnesia, dissociative identity disorder, depersonalization disorder. The dissociative disorders category has been plagued by problems with diagnostic reliability. In the DSM-3 field trials, reliability ranged from a solid 0.8 to a dismal minus 0.003 across the two phases. Reliability was not assessed in the DSM-5 field trials. Maybe it should have been. All symptoms of dissociative disorders can be easily feigned, and they are perhaps overrepresented in situations in which malingering should be carefully considered. Okay, dissociative disorders are easily faked. Something that we need to remember. This is a good plot twist for creative writers. Dissociative disorders. Dissociative amnesia involves a loss of memory for a certain period of time that is too extensive to be explained by ordinary forgetfulness. Memory loss is not due to physiological causes. It is usually associated with a traumatic event. Unlike the amnestic syndromes caused by neurological events, the capacity to learn new information usually remains intact. You just got pieces missing. You can't come up with things. Like I couldn't come up with her real name. I knew her first name, didn't know her last name. The course of dissociative, and at that point I was driving past where she lived on a relatively frequent basis because my daughter lived in Florida and she lived right outside of Valdosta, and I had to drive past Valdosta whenever I went to visit my daughter. Somebody was protecting somebody there. A review, I was protecting myself from her. She's so dangerous. A review of 25 patients found that the most common presentation was a selective chronic loss of memory that did not have a sudden onset. The incidence in the population is unknown. The DSM-5 notes that a small community study found an incidence of 1.8%. Dissociative amnesia. With dissociative fugue specifier stipulates both memory impairment and sudden travel away from home or regular surroundings. There is disruption of personal identity. The person is uncertain about personal information, including name, residence, or profession. An individual with dissociative fugue may wander for periods of time ranging from brief journeys, a few hours or days, to several months, over thousands of miles. Most often, the person with dissociative fugue does not form a new identity. When it does occur, it appears to include more outgoing and uninhibited traits than the original one. And that this happened in I was living in Lakeside City, Texas, which is over by Wichita Falls. And what happened was they found this guy's pickup truck in the middle of a creek. Now, the creeks in Texas aren't very deep, so it's not like he potentially couldn't drive out. And it wasn't stuck. It was just in the middle of the creek with the doors open. Both doors were open, the truck was running, and the radio was on. But he was gone. Nobody could find him. And nobody could find him, and they looked for weeks and weeks, and nobody could find him. That part of Texas is fairly flat and fairly empty. So they looked, and they looked, and they looked. Couldn't find him. They had to declare him missing, and then after 7 years, they declared him dead. And then one day, an individual from Lakeside City went to a conference, and the speaker was this guy, but it wasn't his name, and he was very different. He was very different. He had become a preacher at a gay church, and he was a Baptist. He grew up in a very staunch Baptist home where homosexuality was considered a sin. And here he was a Baptist minister. He was married with 2 children, married a woman with 2 children. But he was the minister of a gay Baptist church, which was kind of against things. Anyway, they found him like 15 years later. They found he was completely different name. And when they told him who he was originally, he was surprised. He had no idea. He kind of lost the whole first part of his life, the whole 15 years, from 0 to whatever age, 26 or 27. He just lost it completely. And he went back to visit his family. His father was dead, but his mother was still alive, which was really kind of fascinating. Anyway, dissociative fugue. There's a guy that had dissociative fugue, obviously. Otherwise, I wouldn't put his picture in there. This may be the guy that from Lakeside City, Texas. Sometimes new identities can be extensive, including assuming a different name, a new residence, and the involvement in new complex social activities and functions. He was a lot more liberal than the person he was before he had dissociative fugue. Amnesia associated with dissociative fugue can remain after the fugue state remits. Severe stresses or overwhelming life events are typically related to onset. Offset is often hastened by removal from the stressful situation. No clear evidence exists for genetic or biological factors in the development of dissociative amnesia. Multiple stressors or overwhelming life events are typically related to the onset Among participating stressors for fugue, the most common appear to be marital discord. Marital discord. He wasn't married before he left. Financial and occupational problems. He was working for his father, and war-related events. And in this case, of course, he was in Lakeside City, Texas. The psychoanalytic perspective presumes that the memory loss is the result of unconscious repression rather than suppression of the memory due to its threatening or unacceptable content, thus dissociating the memory from the person. And like I said, his family was very strict and very religious, very fundamentalist, and possibly he wasn't, and that was part of the conflict. His father was a lay minister, lay Baptist minister. The behavioral perspective assumes that the amnesia is in some way negatively reinforced as an avoidance or escape response. The typical approaches to treating dissociative amnesia involve hypnosis or drug sodium amytal, together with free association to uncover unconscious memories and bring them to the surface. No careful studies of the effectiveness of these treatments for dissociative amnesia exists. This is all psychoanalysis. Because people with dissociative disorders are quite suggestible, there is a risk that the memories recovered during the therapy may be iatrogenic, therapist caused. Iatrogenic. And that's part of the problem. Now, the interesting thing about this case was that everybody, this was written up in the paper over time, and after 3 years when he was declared missing, and then after 7 years, the story just kept coming up. So everybody knew the story of this guy. So it wasn't iatrogenic. Dissociative identity disorder, formerly called multiple personality disorder, is perhaps the most unusual of the dissociative disorders. The diagnosis requires the presence of 2 or more distinct personalities, which disrupts one's personal identity and sense of personal control. Dissociative Dissociative fugue is common. Fugue just means movement. So they have fugues in music, and it's where you're playing along, and all of a sudden you just kind of take off and start playing crazy stuff. That's a fugue. The number of personalities may range from 2 to more than 100, but in half the cases, and I'll tell you what, I'll attach a fugue to your discussion questions if I remember it. Wait a minute, let me write it down. Attach fugue discussion. If I write it down, I'll remember it. There's a really famous one by, not Bach, by one of the Bachs. There's like 10 Bachs. Discussion. It's the father, I think. There's not 10. There's probably 4 Bachs. B-A-C-H. The father and then 3 of his sons wrote music. What are we talking about? Okay, dissociative fugue is common. The number of personalities may range from 2 to more than 100, but in half the cases, the individual has 10 or fewer identities. The fugue I'm going to attach is very famous. You'll recognize it as soon as you hear the first 3 notes. Hello. Several years typically elapse between onset of first symptoms and diagnosis. This is the case of Billy Milligan. He had 24 multiple personalities, and we're going to talk about Billy Milligan. He was caught, I'll tell you the whole story. Billy Milligan, William Stanley Milligan, is the core personality. Wait a minute, I guess I'm just going to, I need to tell you what happened. Okay, so Billy Milligan, this guy right here, the guy with the mustache, was robbing people on the Ohio State campus. He was, and then he molested one of the people that was stealing money from. What he would do, they would be getting money out of an ATM, and he'd come up behind them and take their money. And in one case, he drugged the lady off into the bushes and had sex with her. They they caught him, and they caught him fairly quickly. He only did this to 3 or 4 different women, and it was always women. Anyway, but this is the story of Billy Milligan. Arthur is an extremely sophisticated, educated Englishman. That's one of his personalities. He's an expert in science and medicine with a focus on hematology. Hematology is the study of blood. It's the study of your blood. I am a hematologist. I can do a CBC. I can look at your blood and identify your white cells. I can identify whether your red cells are normal or abnormal. That is what hematology is. I can identify leukemia by sight, by just looking at your blood. He is in the spot that is in charge of the shared body. During times that required intellectual thinking, Arthur came out. Arthur is one of only 2 personalities who could classify a person in the group as an undesirable. And so Arthur is one of the individuals that would identify people. Regan Vidaskevich is the keeper of hate. His name comes from the words rage again. Reagan describes himself as Yugoslavian, has a Slavic accent. He can write and speak in Serbian and is extraordinarily strong. He controls the spot in dangerous times and can designate group members as undesirables. He and Arthur are the 2 that can do that. He admitted committing robbery in order to support the family, but had no knowledge of the rapes. So Reagan was the thief. Alan is a con man and a manipulator. He is the most common person to talk to into the outside world. He plays the drums and paints portraits. He's the only right-handed self. Everybody else was left-handed. He is the only personality that smokes cigarettes. Alan. Tommy is the escape artist. He is often confused with Alan. He plays the tenor sax and is an electronics expert. He is also a painter specializing in landscapes. So Tommy paints landscapes, and Alan paints portraits with his right hand. All the other personalities are left-handed. Now, all this becomes really important because remember he was stealing money, and he raped at least one woman. He may have raped 2. Danny is afraid of people, especially men. He only paints still lifes and never paints landscapes. He says this was because Chalmer made him dig his own grave and buried him in it. Chalmer. Dave, at age 8, is the keeper of pain. He comes to the spot to take the pain of others. The spot is him being out in public. That's the spot. Christine is age 3. She was the one who would stand in the corner in school when Billy would get in trouble. She has dyslexia, but Arthur taught her to read and write. Reagan has a special bond with Christine. Christopher is Christine's brother. He plays the harmonica. Adelena is a lesbian. She cooks and cleans house for the others and writes poetry. Milligan's attorney claimed that Adelena had admitted to committing the rapes without the knowledge of Milligan or the other alters. So they were lesbian rapes. And there are the personalities that they identified for Billy Milligan. There's a whole book written on this guy. Just fascinating. And his case is one of the only cases that they allowed that he was released due to mental illness, dissociative identity disorder. It's the only case that anyone knows of, anyway. As curious as all that is. The course of dissociative identity disorder tends to be fluctuating and chronic. According to the DSM-4-TR, dissociative identity disorder is much more commonly diagnosed in women than in men by a factor of 9 times or more. DSM-5 notes that while women do predominate in adult clinical settings, males are less likely to acknowledge a background of trauma and thus may be underdiagnosed. Okay, so why is this happening? It's usually happening because of sexual molestation as a child. A recent estimate of prevalence in a city in central Turkey indicated it affects 1.1% of the female population. There has been a sharp rise in incidence of dissociative identity disorder over the past few decades, increasing from a few hundred cases worldwide to over 30,000 in North America alone. This corresponds to increased public interest in popular portrayals of the condition in books and films. And two of them was All About Eve was one of them, and Sybil was the other. Sybil was played by Sally Field, and I can't remember, the wife of Paul Newman was the lady that played Eve. There have been reports that various personalities and dissociative identity disorder show physiological variations consistent with being different people. For example, some manifest different EEG profiles and neurological assessments. However, a person who was role-playing multiple personality disorder was able to produce EEG differences across roles, which were larger than those produced by 2 diagnosed dissociative identity disorder patients. This indicates EEG data reflect intensity of concentration and mood changes rather than any inherent brain differences. Now you got to remember, when we talked about Billy Milligan, we were talking about one individual that was right-handed and the rest of his identities or his alters were left-handed. Some painted landscapes, one painted landscapes, one painted portraits, and the other painted still lifes, if you remember this. So he was a painter. One of the things about Billy Milligan was the fact that he kept escaping. He escaped from the straitjacket. He escaped from jail. He escaped for all, and that was one of his alters, was the escape artist. Twin studies have not produced evidence of heritability, although there have been reports that dissociative identity disorder runs in families. No significant neurological or EEG abnormalities were found among 50 dissociative identity disorder patients, suggesting no evidence of underlying brain etiology. Abuse histories are reported in 70% to 97% of dissociative identity disorder patients, with incest cited most commonly, and usually it is same-sex incest. In other words, most of nine times more females than males, and usually it's the mother molesting her daughter that causes these problems. These events, and that's what was happening with Eve, I believe. Eve was being molested by her mother. These events are generally considered central to the etiology of the disorder, as well as responsible for the gender differences in incidence. The ability of normal people to produce apparently different personality characteristics as a result of hypnosis or suggestion, together with the malleability of the memory and controversies of recovered memories, led Spanos in 1994 to propose a sociocognitive model of dissociative identity disorder development. Spanos suggests that symptoms of multiple personality tend to develop after rather than before contact with therapists. An iatrogenic model of DID, of dissociative identity disorder is consistent with the most currently available information on the disorder. Now, this is a problem because it may be that it is the therapist that is actually creating the problem. The process of treating dissociative identity disorder involves a therapeutic relationship of trust and cooperation, an understanding of the network of alters, treatment for the trauma, and work toward reintegrating the different personalities. Hypnosis is common in this process. No well-controlled efficacy studies are available for dissociative identity disorder treatment, either with the pharmacotherapy or psychotherapy. Depersonalization derealization disorder involves the feelings of detachment or separation from oneself, or feeling as though objects and individuals in the surrounding environment were unreal. When transitory, these feelings are relatively common. The DSM-5 estimates that half of all adults have experienced the sensation of depersonalization or derealization. In depersonalization derealization disorders, such feelings are persistent or recurrent. They cause marked distress and are associated with impairment in daily functioning. One of the problems we have with drugs is that a lot of drugs will cause these feelings, especially marijuana. It gives you a feeling of depersonalization and derealization, as I understand. I've never used the substance, but from what I have been told by individuals that use it on a relatively common basis, this is the reason why people use marijuana, for the depersonalization and derealization. Now, one of the problems we're having with marijuana, one of the things we just discovered is that it causes people that smoke marijuana have a higher incidence of heart problems and lung problems, which is logical since it's smoke. You're breathing smoke. But this may be another problem. Mental illnesses are more prevalent with people that smoke marijuana. Schizophrenia will start sooner with people that smoke marijuana. Other problems are exacerbated by marijuana. So it's something to think about. This may be one of the things that you ask your clients. You have these feelings of depersonalization, derealization. Do you smoke pot? Does it happen when you smoke pot? When you anticipate smoking pot, do you get these feelings? These are things you might ask your clients. The lifetime prevalence of depersonalization, derealization disorder is about 2%. The average age of onset appears to be around 16 years, rare after the age of 25. The episodes may be very brief or last for years. It tends to be chronic and worsens under stressful situations. Let me take a quick drink. The DSM-5 states that the male to female ratio for the disorder is 1:1. Carla had wanted to visit Disneyland since she was old enough to remember. When she was 13, her family finally relented and they took a week's vacation in the Magic Kingdom. Everything was fine the first 2 days. Two cartoon characters from Alice in Wonderland, Tweedledum and Tweedledee, grabbed Carla's hands and started dancing with her in front of Cinderella's castle. Carla broke into a sweat and had to sit down. The legs of the people around her lost their bodies, and Carla fixated on the popcorn strewn all over the ground. Carla thought of escaping on one of the rides. When she got on board, she saw that one of those mechanical people was running the ride, and she realized that the ride threatened her very existence. After finally exiting the ride, she ran to Smee of Peter Pan for comfort. He gave her a magic pirate toque to protect her. The people's legs became robot legs, like most of the mechanical people in all the rides and exhibits. It seemed that the only real creatures were the ones with soft legs and body parts. Carla began running from one to the other for a real hug. because she had a magic toque. The tinny music seemed to follow her everywhere. It's a small world after all, would forever mean fear to her. The people all around her moved mechanically. It was just the soft cartoon characters who were self-animated. When some mechanical creatures tried to force her to leave, she tried to hide behind Pluto. When she finally left, she was shaking so hard and crying that the mechanical creatures yelled at her and told her that they would never bring her back to the Magic Kingdom if she kept acting so silly. Carla in Disneyland. The mechanical creatures obviously were her mother and father, and all the mechanical robots were real humans. And the only people that she saw as real were the cartoon characters. The causal factors of depersonalization, derealization disorder, the cause is unknown, no data on familial or genetic influences. Simeon et al. In 2003 report that immediate precipitants among 117 reviewed cases of the disorder include severe stress, panic, depression, and drug use. The DSM-5 notes that there is a clear connection between the disorder and childhood interpersonal trauma. SSRIs do not appear to be more effective than placebos in treating the disorder, although in a small uncontrolled trial, the opiate receptor site blocker naltrexone was associated with a 30% improvement in symptoms. 30% is not very much. Hypnosis and a variety of psychotherapies have been employed in individual cases, but no solid data on relative effectiveness of these treatments are yet available. Other specified dissociative disorder used for subthreshold dissociative conditions in which symptoms may be milder or more acute. Unspecified dissociative disorder used for those cases in which the dissociative conditions have not been described elsewhere. These disorders attempt to classify a diverse set of conditions that are particularly difficult to distinguish from malingering and factitious disorder and overlap frequently with other types of mental disorders. The unusual and interesting nature of these disorders guarantees continued clinical interest in their development and treatment. And that is it. So don't go to Disneyland. Actually, that Disneyland is someplace else. Maybe that's Disneyland France. I don't know. Yeah. Anyway, okay. I'll talk to you guys again later. Don't talk to my wife about what I just told you guys. Otherwise, she'll divorce my